Good afternoon, and thank you so much for joining us today. I'm really excited to be able to share our current topic, organizational support for trauma-informed care and legal aid. Just a little background. I have been working as a social worker within legal settings now, approaching 17 years. And so it is very exciting to see this move towards wellness in the legal profession. It was long overdue. And I am so very happy that there's not only interest, but I'm starting to see really great change within legal aid around wellness. So moving on to our next slide, I just wanted to share a little bit about Los Angeles Center for Law and Justice. I am presently at a nonprofit law firm that was founded in 1973. We are celebrating our 50th year. We serve all of Los Angeles County, and our main areas of legal support, are around family law and immigration. And we very much believe in our mission, which is to secure justice for survivors of domestic violence and sexual assault, and to empower them to create their own future. We do believe that every survivor has the right to legal representation, protection through our justice system, and to have a strong community where families are safe, stable, and free from injustice. On our next slide, I'm sure many of you are familiar with this, but to tie in why this topic of wellness is so important, we look at attorney health and competent practice. The rules of professionalism require strict adherence in order to meet these requirements and deliver competent services. And I say we, but attorneys must be mentally healthy in order to discharge their duties. And there is your California Rule of Professional Conduct to make sure that lawyers shall not intentionally, recklessly, or repeatedly fail to perform legal services with competence. And so in looking over our objectives for today, I wanted to make sure in this short time we are together that we hit on some essential elements of trauma-informed organizations. So there are some key elements, and while you might find that your particular law practice does reflect some of them, there might be certain areas where you will think after this presentation, like maybe there's room to grow. And so our next objective would be like where to begin, right? And so I'm going to pause shortly on organizational assessment. I'm sure many of you can think of why it's important, but it's a really great tool for our following objective, which is to put the information to work and start creating a plan forward. And making a shift is our next one, right? So once you have a plan, how do you either include leadership or work with your leadership to then start creating change around the area of wellness and trauma-informed care? And then are you done? No, we're never done, right? Then we do it all over again. And change does happen over time. So what are some good practices to then move forward, right? And continue growing with the intention of trauma-informed care and legal services. So moving along on our next slide, we're going to be looking at the elements of a trauma-informed organization. So I have these nice graphics on the next slide to kind of show you the 4 R's of trauma-informed care. So many people, when signing up for this particular training, discuss the need to address vicarious trauma, right? So one of the main things that we encounter in legal aid settings is that individuals are coming to us at a very stressful time in their life, right? Seeking out support and legal assistance. But they do not just show up, right? We are also there in the room. So it needs to be both a 2-pronged kind of approach, right? Not only do our clients need to be supported through trauma-informed reflective services, but our organization also needs to support those of us that are serving the clients, right? So the first step would be to realize that people at all levels experience trauma, right? And understand how it might impact individuals, families, and communities. So these are systems That's what we refer to them at in social work, right? These are systems, family systems, our internal psychological system, right? How we deal with things, family units, communities. And also, when our clients go out to seek support, they're navigating systems of care. So I want us to just really center that around, like, even realizing that there's an issue, right? That's important. The next would be to recognize, right? So people within organizations need the tools to recognize the signs and symptoms of trauma. So when you have a client that is maybe calling a front office person who is the one maybe intaking information, they might not be delivering. We like to frame it as, well, they're not delivering the direct practice. But we really need to reframe how we think about trauma, right? So we have an individual seeking out support. The first person they sometimes encounter at an organization is the person answering the phone, responding via email, right? And they may be coming with a lot of exasperation. They might be in tears. They might be aggressive, right? But we have to remember that trauma presents itself in a variety of ways. And so to think that only the staff that is working directly with the client over the legal case is the only person at your organization that requires training and support is probably not a great place to start. We probably have to start with our front office folks who are receiving the calls and receiving our clients and really our first ambassadors of our trauma-informed care at our legal aids, right? And then we move on to number 3, how we respond. So we can look at the programs and organizations within community and look how they are responding in a trauma-informed approach. We have to look at our practices when referring clients. So do we refer when we are not able to assist them in a particular area of law? Is there a practice that we employ when we are referring them to other community partners that might deal with another area of law that we do not? What does that transfer of information look like? Are we then, number 4, re-traumatizing clients, right? What does that look like? Do they have to constantly retell their story? Or have we kind of thought through some of these referral processes, these intake processes? Do we already have the information within the organization, right? We don't want to unintentionally compound their trauma. And also within an organization, they might be dealing with one or more representatives, right? So they might be working with the attorney, but maybe also a legal advocate. Or in the case of our law center, we also have community advocates that are social workers and social work students that are supporting clients through their legal case. So the more we can do to minimize re-exposure, the better. So let's move on to our next slide. So here are some guiding principles, right? So as we start to think about this, there is a way to maybe look at what we are trying to accomplish overall at our organization, right? And you might see that some of these elements are present, but you might then say, okay, but maybe these other areas could be better developed. So I really like to look to, so I am an LCSW, I'm a licensed clinical social worker. And when we're talking about trauma and mental health needs, we oftentimes, I oftentimes will rely on SAMHSA's National Center for Trauma-Informed Care, so that you see on the slide NCTIC. They are really looking at new ways to train employees, right? Not only in public health, but a lot of their skills and a lot of their trainings revolve around supporting staff at organizations serving clients who have mental health needs, right? So you will notice I take a lot of my resources from SAMHSA. I'll be referring to them. And so I just wanted to give some credit where credit is due. So when we're looking at the continuum of care around trauma-informed care, we really have to look at safety being a priority, right? And again, I want us to expand our view, not only to our clients, but also those delivering the services. So are you in an environment where you have a chain of command or a supervision team or a supervisor where you can discuss safety, right? Your safety, your client's safety. Is this even a topic that is being brought up? And how do we think about safety, right? A lot of us feel like we are doing this work because we want to make a difference. And a lot of times things like boundaries or guidelines or just even self-care is not really what's prioritized, right? It's billable hours, it's getting it done, it's showing up and accepting calls throughout all areas of the night. Sometimes there are not professional boundaries. So what I have noticed that's a little different between social work and legal aid is that the boundaries are not quite as ingrained in the professional kind of code as to what you can and cannot do. I know attorneys will take calls in the middle of the night, right? And we can do that, but we're really encouraged to really keep, while being professional and personable and connecting with our clients and being empathetic and empathic in many ways. But one of the things that I think we do, I say social workers do a little differently, is really trying to have those boundaries in place. So I would say safety and boundaries and communicating with clients about the role and that this is a professional relationship and this is how we're going to do business. This is who you contact. Moves on to number 2, right? How can they count on you? How can you be transparent so that they know what to expect? So of all the clients we work with, we have many clients who have learned how to seek out services in a particular fashion, right? We even hear it. The squeaky wheel gets the grease, right? We have the client that might be belligerent and they have learned that that serves them, right? They get their needs met and they haven't really maybe been privy to practices or understand the legal system, or going to court might be really scary and they might really, really want to tell the judge about this other person, and the judge doesn't want to hear that. The judge wants to hear about the facts of the case. So even just learning about the process and what sort of evidence is at a premium and what is maybe best left for, counseling or support networks or other resources, right? So this trustworthiness and transparency about what to expect, about understanding systems, really goes a long way to reducing trauma for clients, right? And then peer support. So this can be very much social, familial, relational. But in this context, I really want to discuss, where does peer support exist at our legal aid, right? Do we have committees? Do we have actual support groups? We've implemented an optional element to our particular support of our staff at LACLJ. We have counsel. So it's a place for us to get together and kind of process. Sometimes we have an open sort of forum, but usually there's a topic and we really get to connect with each other. We also get to bring people together from different parts of our organization doing different work. And through counsel, we have an opportunity to talk about topics and get to know one another. And again, it's optional if people need that support. We found it very necessary with current events recently. Our volunteers, our interns, and many of our staff were feeling very heavy with what's happening in the world. And there was really this need for a trauma-informed approach, right? Something maybe beyond an EAP, beyond maybe a therapist. Other people were seeking out therapy, but they really sought support from the environment that they were working within. And so that's very important. Collaboration and mutuality. So this is very important. Do we have hierarchical systems? Are there other systems within our organization that call in voices that typically don't have voice and choice, right? We talk about voice and choice of our clients when they come to the organization. We value their lived experience. How are we calling that in at our professional level within our org? And then, as I mentioned on 5, empowerment of voice and choice. How are we elevating individuals to grow within our organization? So we know legal aid is tough. It's a tough field to be in. It's also very rewarding. And how do we keep that balance, right? People speak about a work-life balance. There can also be a balance within the work that we do, but we really have to look at those things that stave off burnout, right? So are there opportunities to grow and be mentored? Are there forums for individuals and staff, within teams to share, maybe anonymously, what their experience is like and what they're seeking, or what brings them to work every day and allows them to feel fulfilled within their job? How do we create more of that balance? And then we want to look at something that, is being called forward more and more, right? So we have our DEI committees and our leaders and our champions. But it's very important within the workplace that we also acknowledge that, there has been a need for a shift, a long time coming, and understanding more at how those cultural, historical, and gender issues have lit the way for practices to continue as status quo, as opposed to shifting and becoming more inclusive and letting inclusivity be the status quo. So these are some guiding principles. I promise you at the end, there will be a link that is a deep dive into these particular principles that you can reference and that you'll be able to take back to your orgs and your teams and think about. Our next slide, please. All right. So the importance of organizational assessment. How do you start unraveling where to begin, right? Because there's so many threads. So you can begin at any point and feel like the work is never done. And that's actually a great way to look at it, right? So they always say you can't step in the same river twice. You will forever be changed after today, right? After this moment has passed, we're already on to the next moment. So as you continue to grow, there will always be new things that you see that need improvement, or you'll just seek out organizational growth, right? You'll start making shifts and choices that then course correct or set a new course altogether for the organization and how you do practice. Next slide, please. So there are different means of assessment, and some you may have readily available, are easily available, are free. I try to put 4 down that you could probably start implementing as of today, right? Or at least look over and start today if you wanted to just start seeping yourself in the energy, right, of like change, right? How do you shift? Well, you have to know where you're at. You need a baseline. So ProQual, some of you who may have joined me for past training sessions will realize that I am a big proponent of using the ProQual. So it stands for Professional Quality of Life Indicators, and it's an individual assessment, and it looks at 4 domains, but it's the only one that looks not only at secondary traumatic stress, burnout, vicarious trauma sort of measures, it also looks at compassion satisfaction. So as I mentioned before, if you were to just blindly ask everybody, why do you do the work that you do? Why particularly legal aid? People usually aren't like saying, oh, it's because of the great, money. They have money being thrown at me left and right? They're throwing money at me. The low caseloads, tons of resources, the things that are challenging about legal aid. But in doing your services and moving forward and delivering services, right? I love the laughing. But yes, all of these things that we do on a daily basis with so little in return, sometimes comparably to what is out there, maybe for, an individual seeking out work in our same profession, but in a different setting. It's because of the compassion satisfaction. And the ProQual to date is the only professional quality of life sort of assessment that you can take periodically. Now, at our org, we recommend that our staff do it minimum annually, right? I would like to encourage them to do it quarterly, or maybe before or after reporting is due, grant reporting. You pick those stressful times, right? And it's not enough to just assess where you're at. It's then what do you do, right? But this would give you a baseline. Where are you at, right? How are you dealing in these different domains? The next is quality supervision. So do you have a standing wellness or safety or well-being item on your agenda with your supervisor? Do you regularly discuss how your work and work-life balance is looking? Do you understand at your org, is there a minimum amount of hours or a caseload that is required, right? I have learned over the years that when attorneys first start out at a legal aid, there's a learning curve, right? So they may not take on as many cases. More seasoned attorneys are able and have a process and a system, and they're able to get through it a little bit more easily and plan their time better. But having quality supervision makes a big difference. Are you and your supervisor checking in as to when you're stressed, when there's, maybe high tension, there's something happening or a shift, right? Oftentimes there might be something happening in their life, and within a professional framework, there's a way to communicate with your supervisor. So I would say that it's really, really, really important that wellness be included somewhere in that conversation. The next are trends. So there are different people at your organization that might be privy to trends. And privy to trends. And so what we might be wanting to look at is that data. So we talked about trauma-informed organizations being transparent, right? So do we have high attrition? Are we losing staff, right, after a year? And think of the time and money invested in training them. Think about shifting caseloads. Think about all the work that's involved. So it's worth it for organizational leadership, right, to think about ways to retain staff, right, and get a good feel when you're bringing staff on board. What is it that's motivating them to take this job, right? And find out those areas of professional growth that speak to them. And maybe you're just doing it once a year during your annual evaluation, but maybe it becomes a standing agenda item. And so with that said, it needs to be a standing agenda item so that we're checking in with our supervisor. So the trends that we're looking for: absenteeism, use of sick time. We've made a shift to wellness time, but it's an organizational shift, right? You might not be willing as an org to jump off the deep end and employ this strategy. You might want to run a pilot. You might want to pick particular job descriptions that are under high stress and decide what that wellness time looks like, what needs to be addressed, equitably across the org. And where are you going to pilot certain projects around wellness, right? But we want to look at it organizationally. We want to look at it individually. But there are trends. You do have data, right, that exists. So either it's an HR, either it's the managerial team or the supervision team that's coming in. The directors might have some data amongst themselves that they're noticing trends. So these are things that you can look at, set a meeting for, start collecting some data on. Then there's trauma-informed organizational assessments, right? So there are so many. And on the final link I will refer to, I keep on referring to, there is a link. And when you are on that link, there are several organizational toolkits that are available depending on like how general you want to be. There are some trauma-informed toolkits for those like ourselves that at LACLJ that are working with survivors. You have to look at what they are assessing, right? You might want to modify and create your own. We've really taken a step towards accessibility. We would like to normalize, right? like, it's not the othering of our clients, but how do we collectively meet the needs of our clients? And so in looking at our org, this is something that we've taken on this year in a very large way. And so I would say we are looking to include elements of that in our organizational assessment. Let's move on to the next slide, please. So in looking at those tools, what should you be measuring? What do you want to measure? What are you most concerned with? So I mentioned the first 4 on the ProQual. This is what the ProQual does measure: burnout, secondary traumatic stress, countertransference. Are you over-identifying with your client? And do you have more of an investment in the outcome than maybe you should professionally have, right? Is there a lot pinned on this case because you are over-relating with your client? That's usually a good sign of countertransference. Many of us come into working at legal aids or working with particular communities because we come from those communities or we've experienced that. So it's really important because it has a huge impact on that vicarious trauma piece, right? That's why I'm calling this piece out right here. There are other things that should be measured, right? So you'll notice that there are a few things that are bolded in green on this list. So on the ProQual, compassion satisfaction would be one. You should maybe utilize a measure that also highlights organizational strengths, or the assessment will reveal where your organization is strong, right? You can also gather information around motivating factors. So if you ask questions, more qualitative than quantitative type data, you can ask people, what's your role? Do you enjoy your job? What do you enjoy most about your job? What gets you out of bed every morning and motivates you to show up and give your best, right? So however you want to frame that, but be specific. So I did not put that on this slide. This is for a future training. So check us out again in January if you're interested. But we'll be looking at SMART goals, right? So these motivating factors can be very specific if you wish them to be. And you can start gathering info around that. Response of staff to current events. So what is happening in the world? Is there something legally that has shifted, right? I know at our org, I'll share briefly, at some point, survivors of human trafficking were no longer viewed as criminals, right? Things had changed and shifted. So they were then able to avail themselves of some very good support through CalVZB. Many of you know it as victims of crime funding, right? And so there were funds that were available that were not previously available to human trafficking survivors, right? So that's a shift in culture and perspective and law, in what they can and cannot access, understanding what's happening in the world, right? And why particular communities might have more or less funding of our programs that we are, our services that are being funded. So, and we need to know what's happening in their own life, right? So we may have staff members that are going through something very difficult because of current events, right? That are impacting them in a large way to a large degree. So it's really good for us to be checking in with them. We're looking at things like high turnover, low morale, absenteeism, not just job dissatisfaction, but job satisfaction. Don't forget to ask the affirmative of a question, right? And get specific. I think it's important, at least in the professional guidance that we've received as social workers within my profession. We look more and more to strength-based approaches. And this would be an area, like, definitely find out where are the strengths. So let's move on to the next slide. Okay, so creating a plan for assessment. So that's great. Your org has decided, yes, we want to move forward with this. We'd like to get going. Where do we start? So it's really great if you can identify a team that can serve as an organizational capacity team. We would really encourage you to include individuals from different roles throughout your organization, right? because it's important to reflect the entire experience and to elevate all voices so that there is that equity, right? So this is a great place to center that. You want to encourage organizational readiness. So again, I will refer to that reference. It goes a little bit more in depth. There could be a training on that in and of itself. But it's important to prime your organization for this shift. And maybe a good place would be when you are going to roll out an assessment, explain to them what the goal is. Again, back to transparency, right? And inclusivity. And so you can really prime your org to be in that space so that they're ready for some shifts. So ready to maybe dig deep and think about, how do we continue doing this work, right? How do we do this moving forward? Then you also want to think about engaging partner organizations and individuals with lived experience. This is the part that I find collectively difficult for legal aids, right? Attorneys and legal practices, keep a lot of information confidential. And it's the way we work. And there's a reason for that, right? A very important reason. However, it's also important to see what's happening and how do you make that shift. If we continue to do things the way they've been done, things won't move in the direction perhaps that we would like them to move in. So who are those individuals and organizations that have had experience with this shift, right? Who has something to add to the conversation to help illuminate the darker corners, right? Where are those areas of potential growth? Then you're going to want to select an assessment tool. So again, as I mentioned, it would be great if you could pick a tool that is either general enough to capture, a baseline of information, or you can pick a specific tool that speaks to a community that you're serving, right? Then what do you do with your findings, right? Now that you have this data, I think thinking in advance, and this is something your organizational capacity team can work on, is decide on your data collection and analysis methods. So some have capacity in-house and have people that regularly are assigned to review data. They may be part of your grant writing teams and your analytics teams. And if you don't have one of those, think about bringing in somebody who can run, an analysis on what your findings reveal about your organization. And then you want to come up with a plan for implementation, right? So you want to think about, when are we going to roll this out? When's a good time to roll it out? Traditionally at our org, we've rolled it out at the end of the year, in full. We are going to try something new this year. We're going to roll it out at the beginning and hopefully set goals moving forward. We know that before the holidays, it's a mad dash to finish up, tie up items before we leave and return during the new year. So you might need to look at the ebb and flow of your organization to decide where this might best fit in with your organizational plan. Next slide, please. So how do we put these results to work, right? We're going to move along and take a look at the next slide. So here's your action plan, right? Here are some tips for creating an action plan. You're going to create goals around areas of desired change. So you might find from the data collected that there are some particular areas where it's sobering to see where there is some needed growth, right? And so it's good to create goals around that. And as I mentioned before, when we're talking about goals at a later date, having those SMART goals, right? And many of you are familiar with SMART goals, right? Specific, measurable, right? You've heard these before. But the E is equitable. That is something we've added in the last few years. And it's really important because if you really want to see organizational shift, it needs to speak to all members of your organization, right? It also needs to speak to the community that you're serving. And that's where that E is going to come into play. So creating goals around areas of desired change, this would be one of those key elements. Understanding why you prioritize these goals over others. So again, you might find 20 hot items on that list that you feel are really important. But of all of them, how much can you actually accomplish within a year's time? Maybe some are easily accomplished. We hit a few of those first. Or maybe as a team, you decide that this one is like pivotal, right? If we can address this one, then these others will start coming more naturally and fluidly within the org. So we need to decide that. We need to think about what steps need to be taken to achieve them. So what do you have and what do you need? Do you need funding, right? Determine also who will be responsible for what part of the plan. So it may be a team approach. It may take several teams. It may take the management team. It may take a team made up of individuals across the org. But it's really important to have accountability be part of this process. And then setting deadlines around when particular goals would be ideally accomplished. So again, is this a short-term goal, a long-term goal? Is it a 3-year plan, right? What elements need to take place? Where are the high points? Where do we need to hit? And then identifying what measures have been put into place to indicate goals have been achieved. So how do you know you've arrived, right? How do you know that you at least hit one of those milestones as an organization? What does that look like? Right? So that's really important. Those might be good questions to embed in your assessment, right? So you can think of it from many different angles, but some of you might be at legal aids that are like, 5 people, and others, we just hit 50 employees at our 50th year, right? So it's taken a while. I like to think of us as tiny but mighty, right? In a lot of ways, but we know those of you at legal aids that are longer, have been around longer and are larger and have larger staff members, number of staff members. It's harder to course correct when you have so many working parts. So being realistic about those goals, right? That's also part of that SMARTY goal. So be thinking about it, but thinking about it within your organization, right? Personalize it. Let's look at our next slide, please. So many of you say, I've attended this training. It sounds great to me. I love the ideas. How do I gain organizational support? How do I work with my leadership at my legal aid? Are you the leader at your legal aid? Are you leadership, right? Where would you want to start with this? Do you want to consult? Do you have other support networks professionally that you're a part of, that your organization is a part of? How do you support these measures as leadership at your organization? And how do you approach leadership? So let's look at our next slide. So if you are the leader, or if you have a goal, or if you're in a position and you aspire to be a leader within your organization, a key element would be open communication with staff. So this goes back to the transparency, right? And trustworthiness. It's not just between ourselves and our clients that we serve, it's also within the organizational leadership. Is there trust between the staff members and those reporting to leadership? And is leadership accountable? So how does that work? Transparency with organizational decision-making. So, there are those situations where it's like, well, in my position, I need to make this decision. And it's not a group decision, right? It's not a democracy in this situation, or in this situation, this does not happen. But are we transparent about that? That's part of that role. That person bears the responsibility of that decision. Or are we transparent and say, maybe that's not working. Maybe the decision-making power needs to be levied across several different programs. Okay. Establish a commitment to being trauma-informed in writing. So this is something I believe for our organization at LACLJ really became so evident back in 2019, 2020. I think stating what you believe in, looking at your mission statement, looking at your vision statement, looking at what values guide your organization, really go a long way to influencing your policies, practices, and procedures, right? So within your role as an attorney, you have certain expectations, right? This is what you bring to it. This is the law. This is what you follow. But how you do your work, right? And how those at your organization, at your legal aid, do their work can be guided by these principles. So do your policies, practices, and protocols reflect your organizational commitment to level power, right? Is it equitable? Is it apparent in the way things are written that the goal at your organization is to be trauma informed? How are we doing that in practice? And have we formalized it by putting it in writing, right? Have you identified a champion in a position of authority, somebody who's a decision maker, who is dedicated, right, to the principles and practices of the organization? So I have a very lengthy name, but I mean, I'm definitely, I would say things that have existed forever are then passed, by me. Does this sound trauma informed? Or we discuss things. Hey, we've been practicing this way for a while. Could we perhaps be more trauma informed? What have we learned this year? Right? This constant need to reflect, to seeing if we practice what we preach, right? And so we need to look at this. So identifying maybe somebody or some people in leadership positions who have decision-making power, who are in that role, to look at that. Or do we want to collectively look at it as an organization? And then encouraging leaders to model trauma-informed care and practices. So you'll learn a lot of these acronyms, but you get the gist, right? It's constantly, let's look at this as being a universal approach, right? And create an equitable process so that all members of an organization hold themselves and each other accountable. But you need to start somewhere, right? Are we speaking it? Are we saying it? Are we printing it? Are we following through? And when we're not, are we checking in with our supervisors? Are we checking in with our leadership? Do we want to then become leaders at our organization? Is there a pathway for that? Right? Where does that exist? And, or am I going to reach a ceiling? How does this work? And how does that work overall? Because one of the best ways to stave off burnout is to have fresh challenges, new skill sets, mentorship, great supervision, right? To feel like you're actually having an impact in the world, the work that you do. That's where it begins. That's where you can really stave off burnout, right? That's where burnout kind of lives, right? When you've been doing the same job for a long time and there isn't a lot of variability and there isn't a lot of sense of growth or effectiveness, right? So it's important to take a look at that. Let's take a look at our next slide. So sustainability. So we've done this once. Say your org commits to doing this for a year. You take a look at your legal aid. How have we shifted? How have we grown? Where are we at? We reevaluate. We do it again, right? We look at these measures again and we keep it up. Maybe we have a 5-year commitment to shifting particular things within our organization, our means of practicing, right? So let's go on to our next slide. So here we go. How do we maintain? How do we remain vital? How do we remain healthy and well within our role? Conducting the trauma-informed organizational assessment annually, right? So committing to having a baseline to begin with, and then measuring ourselves and holding ourselves accountable. Actually seeking funding for trauma-informed projects, right? So are we including this in our plan? And do we understand how it's connected to our services? How, we already have the data. We know that attorneys are very much at risk for substance abuse and dependence, that there's suicidality. There are a lot of other things that are directly connected with well-being, right? So if we still have a culture, a grind culture that doesn't prioritize a balanced approach, and we don't have practices at our legal aid that reflect that, and we don't have some sense of accountability, or at least a need to sit down and reevaluate, how we're approaching this work, then how can we ever hope to really address the long-term outcomes that we continue to see within legal aid, right? So it's nice that you're attending the training today, but it's not going to be enough without action, right? So even if on a personal level, you go to ProQual and you start evaluating yourself and seeing where you exist, what is your baseline? And you develop a wellness plan around keeping yourself healthy, and you seek out a peer support network, and you seek out wellness within your supervisory relationship with whoever you are reporting to. If you are the one with staff reporting to you, how are you holding yourself out as a model? Are you working 80 hours a week? Is that sustainable? Or does that result in like a heart attack, right? Or like long-term physical outcomes. So I did list another resource at the end. While not completely indicative of everybody's experience, it is one way to view it, but your body definitely will give you signs that you are not taking care of it. And either you make time for it or it will make time for you, and not in the way that we wish usually, right? So it's important that we start somewhere. Seek funding for trauma-informed projects. Really center it in your work. Monitor trends in caseload, staff attrition, sick leave, reports of burnout. So what are you seeing today? What are you seeing right now at this time of year? It's the end of the year. I know people are closing cases. People are trying to tie things up. Where are you today? I know it's probably really hard for a lot of you to even jump on this training at noon right before the holiday. So thank you for those who have attended and are like very present and in the moment and being mindful about this. Ongoing training of all staff on trauma-informed care. So do not dismiss those picking up the phone or those that are returning calls or those that are maybe non-legal staff. Don't leave them out of the trainings. They need that as much as everybody at the org does, if only to understand what it is that they are seeing when clients approach them in a variety of ways that may not feel so warm and fuzzy, right? That might be difficult. And how do we speak to them, right? So again, that's information that's centered for another training, but I wanted to at least acknowledge some of you did indicate that you wanted to learn more about how do you work, right? With individuals that appear to be traumatized in different ways. So provide professional development. Where does your team want to grow? What would make this job balanced and fulfilling? Hiring a trauma-informed workforce moving forward. So what qualities are you looking for in those that you bring on board, right? It can't just be a warm body with a law degree. It has to be somebody who's committed to the work, who may also experience that compassion satisfaction, who has the requisite skills, who wants to learn about a particular community, right? Who's committed to inclusivity and equity, because that will go a long way to support the entire team, right? Not just that one piece of the work. You're looking at somebody who helps to uplift a team, right? I love it. My team was 1, and then it's now 4. And I have to tell you, to watch them work together to support the legal cases that we have is such a joy, because I know that they're working hard, but they're not alone in this work. It's important that you not feel siloed in this work. Practicing diversity, equity, and inclusion. So from hiring practices to elevating voices and choices of our clients, of our team members, of our staff members, supporting mental health and well-being of staff through multiple practices. So do you have wellness days? Do you do wellness walks? Do you check in with each other? Do you have wellness resources? Do you have an EAP? What do you have that is at your disposal? What can be included? A lot of things don't have to cost money, but they do usually do best. Practices are great when you're onboarding them with some teamwork and consistency and accountability. So I would say create this however it makes sense at your org. Some of you might be working virtually, some in office. Do all your meetings have to take place sitting down? Can you be in motion? Can you be getting some vitamin D? Can you be moving? Right? Can you learn to be mindful? Can you sit in the moment and be present? Or are we so busy multitasking that we're not fully present for any one of those things that we're doing? Right? Provide trauma-informed reflective practice and clinical supervision. So checking in, like I said, that supervision piece, check in with your supervisor. So we have a tool, the social work team that we use with our interns, and we check in because we realize that we may come from a different walk of life from our student that is placed with us, right? And like, are you leveraging like resources, right, that you have available? But we're checking in with our team, and we're constantly like wanting to acknowledge there's a differential, there's a power differential. We may not look like each other. We may socioeconomically, racially, culturally, however we may show up differently than our team member. So how are we calling in their voice? How are we leveling an environment so that we can truly have good communication? Is it something that doesn't work out for you? Do you need to seek out other support within your org? Right? So it's all very important to look at. And you want to create a trauma-informed referral network, either other legal aids doing the work, other social service programs that support the work that you do, whether that's in the community, or if you decide to bring social workers or other supportive staff in-house, right? There's a way to do that. And, you know, it just takes some sitting down and thinking through and piloting. You won't know until you try, but you can make some educated moves based on the compendium of information that's out there. So let's move on to our next slide. So here are our references and resources. So this practical guide for implementing a trauma-informed approach is the SAMHSA reference that I was referring to. A lot of what I discussed today, the little nuggets and the guidelines and some sample assessments are available. The Kaiser ACE study is for you personally. How have you been impacted by trauma and hardship in your life, and how is that showing up at work with you, right? It's good to take a look at that. And if you're not familiar with it, definitely it'll give you a little bit more information. You might have staff members, or you yourself might have struggled at different times, or you might just like having the resource on hand for your staff. But Substance Abuse and Mental Health Service Administration at SAMHSA has some good resources that you can tap into. We have 2 books listed here. We're going to add a third when it gets mailed out to you with your certificate. One is The Body Keeps the Score. So how is this trauma and stress showing up? A lot of emphasis on vicarious trauma. How is it showing up in your body? It'll manifest one way or another. It doesn't just dissipate into thin air. Trauma stewardship. How do you sustain this work? This is a really good resource. And then we really want to bring in BIPOC voices. So we're going to list 1 or 2 more resources that might, speak more to us. It definitely spoke to me as a Latina. I definitely saw myself more in those stories and those references. So I hope you find something really great in these resources. And then the pro call. I encourage you to do it today. I encourage you to follow up and create a wellness plan. What do you need to do to feel balanced? And then our very last slide is how you can reach out to me if you would like to. I very much appreciate your time and attention, and I hope that I have provided you with some resources to create a more trauma-informed workplace. Thank you.
Thank you for joining us for today's webinar. This webinar was hosted by the Legal Aid Association of California, also known as LAAC. We are the membership organization for California's civil legal aid nonprofits. Our job is to advocate in the legislature, in the courts, and with the State Bar of California on behalf of the community of nonprofits that serve low-income Californians. In addition to our online and in-person trainings, LAAC provides coordination and advocacy for increased funding to support organizations like yours. Thank you.